Now, if we click on diabetes sensor, you're going to find out a lot of information about your personal risk of diabetes. Also, in case you ever should develop diabetes, how best to treat it, because there are genetic differences from person to person. So in the introduction, you're going to be able to read up on what really diabetes is. And essentially it is a misregulation of blood sugar. And this has a number of genetic reasons, but there are also lifestyle factors that can influence this. And this is really what gives us the possibility to use genetic information to change your lifestyle to best handle your genetic risks that might be present. So if you click on Summary of Effects, you're going to find out a lot of personal information about your personal risk of diabetes. So starting here, the first bar tells you your genetic risk of diabetes type 2 in general. Now there is an average section here in the middle. So having genetic risk for diabetes is very common. Some people have a higher risk than the general population. Some people have a lower risk of the general population. So if your arrow or your bar is around this area here, which means that you have the same risk as the general population. If you're up here, you have a higher risk, or you might even have protection, so a lower risk than other people to suffer from diabetes type 2. Then if a person suffers from diabetes and it progresses, at the beginning usually you can use certain drugs to control the blood sugar, but in some cases insulin will eventually be required. And insulin needs to be injected, and it helps the body to regulate the blood sugar more effectively. This progression of worsening of the disease is different from person to person, and it is influenced by certain genetic variations. So in this bar, you will see if you have a normal progression to a more severe form of diabetes mellitus type 2, or if you're likely to require it sooner. And then there are a number of different drugs that are being used to medically treat diabetes, and they all have different effectiveness based on their genetic profile. So glibenclamide, for example, in this case is quite ineffective, while it might be more effective for other people due to a different genetic profile. Tolbutamide in this case is quite effective. Then glimepiride is quite effective, and metformin is less effective in this case. So do check this. You will find the effectiveness of different drugs, and if you ever should require to use drugs to treat diabetes, this is a good guide of which drugs to try first. So you should talk to your doctor about these drugs and enable him to use your genetic information to improve treatment. But of course, the main goal should be to prevent diabetes from occurring altogether. So if you click on prevention, you will find a lot of information that will help you change your lifestyle to reduce your risk of developing diabetes, which might be quite high, might be lower. So do read through this information. It will tell you what to look out for to ensure that you have a healthy lifestyle and prevent the development of diabetes altogether.